Okay, good afternoon and welcome to a special webinar on the Caregivers Florida Career Program, the 5 W's, and how providers can participate. I'm Kristen Knapp, Senior Director of Strategy and Communications for Florida Healthcare Association, and I am your moderator for today's webinar. We are so excited to have so many of you join us today to learn how your skilled nursing facility can participate with this program. We know that all of you are experiencing significant workforce challenges, and this grant-funded program is one of many FHCA initiatives that we're focused on to help support your efforts to recruit and retain the staff you need. Just a few announcements to help our program run smoothly for you today. Due to the large number of participants, all attendees are muted. We encourage you to ask questions throughout the presentation by typing your questions into the question box, and the slide you see now shows you how to do that. The webinar is being recorded and an online archive will be available on FHCA's website, as well as the floridacarefortheaging.org website, which is where interested and participating skilled nursing facility providers can find the information and resources associated with the Caregivers Florida Career Program. Today's presenter is Jennifer Zolkowski, owner of Q3 Healthcare Consulting. Jennifer and her team are the project leaders for the Caregivers Florida Career Program and will be your point of contact to help get you set up as a participating provider and access the many benefits that the program has to offer. So Jennifer, I'll turn it over to you to get started.
Good afternoon. Thank you, Kristen. I'm really excited to be able to talk to you today about the Caregiver Florida Career Program, how it started, and what the benefits are for you. So let's get started. So first, I wanted to try to explain to you how this program is funded and how it works. So Florida Healthcare actually has a separate nonprofit entity called the Florida Healthcare Education and Development Foundation. That entity applied for the grant and was approved by the state of Florida, the Agency for Healthcare Administration, which we all know as AHCA, and CMS, the Centers for Medicare and Medicaid Services. The grant benefits all skilled nursing facilities in the state of Florida. The amount of the grant was $1.8 million. And those funds come from the Quality of Long-Term Care Improvement Trust Fund, which is administered by AHCA. The fund was established to support activities and programs directly related to the improvement of the care of skilled nursing facility residents. Where did that money come from? It came from you. It is money that is collected from the CMPs that are assessed on surveys. So you can apply for grants to get money that's been put in there from the survey fines that we all pay. So again, I just want to make sure it was clear that this is open to all skilled nursing facilities in the state of Florida. So if you are an organization that has facilities in other states, only your facilities in Florida could participate. It also is not just limited to FHCA members, although FHCA Education Development Foundation received the grant, the actual grant is for all skilled nursing facilities in the state of Florida. The program runs for 2 years. It started in October of this past year, and it runs through September 30th of 2023. The goal of the grant is to increase the number of certified nursing assistants by 3,000 over the 2-year period. And obviously, however, we would love to have more than 3,000, right? So I'm going to give you a little bit of an overview of the program, and then I'll go into a little more depth on these in the next few slides. This program will use a multifaceted approach to help connect Florida skilled nursing facilities with individuals seeking a career in long-term care. This is the recruitment phase, and that includes a robust media campaign to connect with training facilities and new job seekers. The program also includes a retention phase to help employers with employee engagement and satisfaction through surveys that will provide educational opportunities. And there's a new website. So the new website is florida.carefortheaging.org. This website will provide information to all job seekers, but it will also have an employer portal page. This will allow you to search job seeker profiles, access customizable promotional materials, and complementary educational materials on workforce-related topics. So let me get a little deeper dive into the recruitment phase. The program has engaged the Moore Agency, which is a national advertising media firm. They conducted market research in November and December to help build the campaign. Based on those results, print and electronic materials are being developed for broad distribution throughout Florida to training facilities and job seekers. And the ads that you see on this page here are just examples of some of the things that are being developed. For the recruitment phase, the website floridacarefortheaging.com is being built out to provide information to job seekers on the rewarding careers available in long-term care. Not necessarily just CNA jobs, although that is our focus for the grant. There is actually other information for all positions that are available in a skilled nursing facility. It will allow job seekers to submit their profiles and assist them in finding training programs in their communities and connect them with participating skilled nursing facility employers in Florida. So this is what they will see when they go to the website. So for the retention phase, the program will use employee satisfaction surveys to measure and analyze the engagement and satisfaction of employees in participating skilled nursing facilities in Florida. From these surveys, participating providers will be able to access these results, as well as educational material that will be developed for the SNFs based on the survey results. All of this information will be accessible to participating providers on the florida.carefortheaging.org website under the employer portal. So let me tell you a little bit about what's going on right now. So during the first 3 months, we've had a lot happening. So October, November, December was really our build out phase. So now by the end of January, beginning of February, the website will be completed, including the participating provider portal. We will also be including the Florida Association of Career and Technical Education, Career Source, and other training programs as well, with signing up the nursing facilities as participating providers. So we actually had a meeting with the Career Source people. It was a great meeting, so it's going to be a great partnership with them. And then we've been doing a lot of work to sign up participating providers, and I'm going to show you how to do that in a little bit. In February is when we will actually be launching the media campaigns. So those will go out in multiple different areas, different avenues. So those will be broadcast throughout the state during that month. It is also the month where the employee satisfaction survey will begin. And we are going to have a webinar regarding that survey on February 10th. So stay tuned for more information coming for that webinar. In March, the results of the employee satisfaction survey will be finalized, and the results will be posted on the employer portal of part of the website. From the results, you will be able to determine topics for future educational webinars. Remember, you can provide feedback on this work, on any of the workforce topics that you'd like to see. So if you have any thoughts about a particular topic, please let us know, because we'd be glad to put something together for that. Participating providers will also have the opportunity to share best practices and be featured in some of the upcoming webinars. So there are great free benefits for those providers who want to participate. And I want to underscore it's free. So again, if you decide to participate, here are the things that you will have access to. First of all, you'll have access to the job seeker profiles through the floridacarefortheaging.org provider member portal. So if you sign up, you'll be able to sign in, and then you'll be able to search any of the submissions for people that come in. You will probably be able to also search them by your county, so you'll be able to see them, those people that, based on where they live. There will be complimentary job postings via the interactive job board, and I'll show you a bit of that in a minute. There is free employee satisfaction surveys. I mentioned that a while ago. 1 survey per year for the next 2 years. The results and analysis of that survey will be available to you at the facility level and at the aggregate level for the entire state. And then, of course, you will have access to 2 complimentary webinars per quarter on workforce-related topics. Here's some additional benefits for you. There will be free customizable promotional materials that you can use. So for example, here at the bottom, this would be something that you could then go in. You can actually put your logo on these things. There's going to be additional exposure to job seekers via placement on the website. So your provider will be part of the state of Florida will be listed, and then we can click on each part of the state and see what providers are where, and they can click on your actual facility and get some information about you. It would also allow you to have a link to your website, which then you can then, have it go to your job website if you want, or your informational, just general informational page. It's up to you. It also will give you the greater ability to connect with potential job seeker referral sources. So the Career Source Florida's, the different CNA schools, that's part of what my organization Q3 is going to be able to help you do, is set up those avenues for you to be able to connect with those people to hopefully get more CNA candidates. What we ask from you, so it's not a lot, but there are a couple things that we need you to do. Some of them are required by the grant, and then some of them are just, if you want to participate, that's part of participation. So first and foremost, respond to the potential job seeker referrals. So if we have job seekers who put their profiles out there, you can certainly go in and review those, but we also may send you some. If we notice that there's a job seeker maybe in Tampa and you're in Tampa, then we may be sending those to you and asking you to review those and get back to us. So, making sure that you are able to do that is one of the responsibilities. Update your job openings as needed. And that's on the new enhanced FHCA job board. So this picture here is a little glimpse of what the new job board is going to look like. If anybody knows what the old one is, it's totally going to be different. So this new enhanced job board is much more like what we're used to nowadays, where you see LinkedIn jobs or any of those, that format. So I definitely think it's way more user-friendly for you to be able to post your positions. But that's coming up very soon. So hopefully you guys can use that. Participate in the employee surveys. That is something we are required to do by the grant. We definitely will need your participation. It's not going to be that hard to do. We will send you the information via a survey link and then ask you to send that to your employees. So it's very minimal on your part. Just send it out to them or post it where they can go on and do that survey on their own time. And then we will require that you report a few pieces of data back to us, usually on a quarterly basis. And let me show you what that information is. So the data that will be requested quarterly is the number of new CNAs hired in the quarter, the number of CNAs currently working in the facility, the number of vacant CNA positions, and your CNA turnover rate. There will also be a few questions about your interactions with the program, because again, this grant is about helping you guys get more CNAs. So if there are things that we may ask you, like, how is this working for you? Or, what do you think could be done differently? Because if we can make changes as we go. It's a 2-year program. So we definitely want to hear your feedback. So how do you become a participating provider? There are several ways you can sign up. First of all, you can use this link on the FHCA.org site, or go to https://tinyurl.com/YME56WX8, or you can contact us at flcfc@q3hc.com. Or once the Florida.Care for the Aging website has been updated, you can go there and click a button, and you'll be able to complete the online survey and register that way as well. I do want to say that if you are part of a larger organization, we've actually reached out to many of them already, and we have a worksheet, an Excel worksheet that they can populate and send back to us, so that you guys don't have to do it individually. We can sign everybody up at one time. So again, if that is of interest of anybody, you can just contact me at flcfc@q3hc.com, and I can send you that spreadsheet. Or if you want to know whether or not you've already been signed up, you can email me, and I can actually let you know about that as well. So as I wrap up this presentation, let me just recap a few things. First of all, it's free. It doesn't cost you anything. We have very few things in this world that are free, but this is a free program, and it provides you additional resources and education. It'll provide you additional applicant flow, which I think everybody would be interested in. And the goal is to help you hire more CNAs. So there's only a few items we ask from you. And again, feedback is a very important part of this program. There is an opportunity once we get started to utilize some resources in some other ways. So, we'll definitely want to hear any kind of thoughts you might have. We'll be tracking on any of those kind of ideas that you have, and we'll make sure that we can incorporate them in over the next 2 years of different different things you might want to do. So for example, if you said, hey, it might be helpful if brand new CNAs came in and they had a basic level understanding of EHR systems, that might be something we could help with. I mean, so there's no idea that, you shouldn't not present, because it certainly could be something that might be possible. So with that, I'm going to switch it back over to Kristen so that we can answer any questions that you may have.
Okay, thanks, Jen. And I just want to add a couple of things. So, one of the opportunities that this grant allows us to do is a statewide, robust advertising and marketing campaign. Jennifer mentioned the research that the Moore Agency conducted to determine people that were interested in entering, the potential careers as a certified nursing assistant, where they go to get their information, whether that's, Instagram, Facebook, YouTube, Google Ads, digital, there's lots of, a lot of advertising we're going to be doing on social. People are getting their news online now. So a lot of our advertising opportunities are going to be initially launched on a digital platform, but it's a 2-year grant. So we're going to be looking at shifting as we analyze the metrics from our ad campaigns. But we have a significant amount of money that this grant allowed us to invest in a marketing campaign, which we haven't been able to really do previously. So we're excited about that because this will allow us to really drive those job seekers to the website, to populate those job seeker profiles that you can then access as part of this program. So we're really excited to make that advertising opportunity available. And as Jennifer mentioned, all the ads that we're developing, you can take and customize them and use them for your own advertising. If you've got job vacancies in your building and you want to advertise, use our promotional materials and use them in your own advertising campaigns. It's a very simple program that we're going to share some information about after we've got our folks signed up. Add your logo, push it out, and we're going to make it easy for you. Okay, so we've got a couple questions, and the first one, it relates to where the data, I know you mentioned the data regarding the employee satisfaction surveys and that those do come from our providers' current employees, but can you just elaborate, Jen, a little bit about what we're going to be looking for from those employees and how the survey is going to look?
Sure. So again, yes, the employee satisfaction survey is a survey that is going to be sent out to all the participating providers. And we're going to be asking you to share the link with your employees. So the data that comes back will be from current employees of participating providers. The satisfaction survey is very similar. I'm sure all of you know and have done satisfaction surveys. The questions that we ask are very similar to the ones that you probably asked every year for a million years. So, we're asking, what, just their satisfaction of their job, how they like their employer. There's just different questions like that are the standard ones that we've used for years for employee satisfaction surveys.
Super. Okay, we've got a couple of questions related to the types of employees, personal care attendants, full-time, part-time. And I will say that in our messaging that we've developed for our ad campaign, we do mention that there's an opportunity, and really it's referencing the personal care attendant program. This is an opportunity to work where you learn where you work, and where you can begin earning a paycheck immediately while you're preparing for your certification, which is what the PCA program really is. It's a pathway to become a CNA. So that's in our messaging. That's part of our advertising campaign that we're going to be pushing out there. And we're not really limiting anything to mention, this is for full-time, part-time. It's just the position itself of, ultimately becoming a certified nursing assistant and then growing your pathway in long-term care, your career pathways and the opportunities that this jumping off point can afford. And I will also mention the Care for the Aging website is live. If you check it out, it doesn't just limit in terms of a job seeker going there to look for information. It does also highlight other disciplines in long-term care. So while we're driving certified nursing assistants there, if through our advertising campaign, someone who might be interested in long-term care in general as a place to work, they can learn about becoming an administrator, an activities professional, a social worker, therapy. So it highlights all those different career pathways. So I think we're going to see some ancillary benefits from the advertising that we're doing just in raising awareness about career opportunities in long-term care in general. So we've got a couple questions, Jen, that relate to the grant training purposes and even paying for training and certification.
So let me answer that. So there are other grants that have been done in other states where it did pay for training. However, in the state of Florida, there's already mechanisms to pay for training. So this grant is not allowed to pay for the training for those people. However, if you sign up and be a participating provider, one of the webinars we'll do is to teach you how you can be reimbursed in the state of Florida for part of or most of the training cost. There's different ways. It's either through the state you can get reimbursed. There are different opportunities, even maybe through Career Source, where they may pay for some of the training in different locations. So there's different avenues that may cover the cost for people. So that will be one of the webinars that we will do up in the next upcoming, couple of months.
And we've got a couple more questions related to marketing. We're looking at developing partnerships with schools, high schools. HOSA is an organization we've partnered with in the past at Florida Healthcare. We're going to be, now that we've gotten through COVID, they're reinvigorating the HOSA conference. The way our advertising campaign is set up, we're not targeting people that are in healthcare. We're targeting people who maybe go onto a website and Google, what jobs are there in healthcare. We're going to be working with community colleges, technical colleges, local workforce development boards who have people that are coming to them looking for a job, and helping those organizations as our partners help provide information about, well, this is an opportunity to have a place to work in a growing profession that's always going to have vacancies and only going to need more people to come in to work for their profession. So the more agency is nationally recognized for their advertising and public relations skills. They have CareerSource Florida as one of their clients. They work with the workforce, the state of Florida, economic development, workforce development. So we've got a lot of strong partnerships that we're building as part of this grant. And again, our focus is really on making sure that more people, not just, our target audience is not just someone who's in healthcare, but someone who's considering healthcare as a potential career. The other thing, I see a question here, and Jen, I think we lost your screen, but I'll keep talking.
I know, sorry.
That's okay. I'll keep talking. Someone mentioned that they're currently advertising on the Florida Healthcare Job Board. As you know, it's free to post your job on the FHCA job board. What's different now is that we don't do any advertising to drive people to the FHCA job board. You're posting there. We're in there if people are doing Google searches, for healthcare, nursing homes, but there's no paid advertising behind the current, the job board that we have now. But we're putting a significant investment behind this program to advertise that we're hiring in long-term care, and we're specifically looking to recruit CNAs and what the CNA position does and how it offers a career pathway. So the difference in what you're doing now by going to the website to post and what this program will offer you is that we are taking dollars and putting them behind an advertising campaign that are going to specifically drive job seekers to the job board, to post their individual resumes or profiles onto the Care for the Aging site that you will then be able to search by zip code. If you're in the Tampa area, you can look through that list of job seeker profiles. What's happening with the website now is periodically we get a few people that send us a message through that website. Those come to me, and I will pass them out to employers, members in the area. But now we're going to have an ad campaign with a form that actually connects the dots. You as a provider will be connected to the job seeker. So we're really excited about that opportunity. Let's see. Can we cover again what the grant pays for directly? So the grant is really funding the program itself. It's funding advertising dollars. It's funding webinars and educational training that will be made available to you. It's funding promotional opportunities. It's funding the process of connecting you with the job seekers that are coming to our site. It's funding the partnerships that we'll be developing to help you connect to job seeker referral sources. It's going to fund the employee satisfaction survey, which will help inform our webinars. It'll help inform your decision-making and your retention strategies. And, a big part of it, again, is the advertising campaign, which we've never had the ability to do. So we're excited about that.
And the website, whole new website that was done that gives all that information to the job seeker and allows them to submit those profiles to us.
So it looks like we've got a few questions that relate to the reimbursement or the paying for training. So, and I think that's probably a little bit more of a deeper dive. So I would say we encourage you to sign up for the program so that, you know, you're part of this experience. You can get information about how you can have some, you know, trainings paid for, certifications paying for. There are grant opportunities at CareerSource. The local workforce development boards do offer grant opportunities to organizations. So that's part of this partnership. We're going to be able to help provide you with more information about how you can do that. So I think with that, so let me see, I don't see and really we'll take any more questions. I'm kind of scrolling through. It looks like we've gotten most of the questions. A lot of the questions really surround the training and payment for training and education. So we're going to focus, that's good feedback for us. So we'll definitely focus a webinar on how we can share information with you all about how to do that. So what I will say is we're going to put a recording of this webinar on the FHCA website. We're going to also put it on Care for the Aging. But if you are on this webinar and you have not signed up, we encourage you to do so. You can get the sign up link from the FHCA website. We're going to email it to everyone who is on this webinar so you can sign up. Jennifer's email will be included in that. So if you are part of a multi-facility organization and you want to sign up all of your facilities at one time, then we can do that for you. We want to make this easy for you. We know you've got a lot going on in your buildings, but our job is to try to help make your job easier and try to help you with your recruitment efforts for certified nursing assistants. Yes, this program specifically, the goal of the grant is to recruit certified nursing assistants. We had that question, but again, the marketing that we're doing is just going to help raise awareness about long-term care. We drive people to the job board. They're going to see all your job openings if you're hiring for RNs, LPNs, and other positions. So I think that that's just an added bonus that's going to come as part of our marketing efforts. So with that, I am going to tell Jennifer, we thank you so much for being our presenter today. And I appreciate all of you for spending a little bit of time with us on this webinar. And I will look forward to seeing all of your names in our participating provider list in the next few days. So feel free to reach out to us if you have questions, but be on the lookout for more information soon. And thank you all for participating and keep up the great work.